Planet-warming greenhouse gas emissions are a significant concern, and the global food supply chain plays a crucial role in this issue. A recent study highlights that these emissions could decrease by 17% if people shift towards more plant-based diets. This change is particularly impactful as over 56.9% of the global population currently overconsumes, contributing to 32.4% of global dietary emissions. By adopting the Planetary Health Diet, proposed by the EAT-Lancet Commission, these emissions could be significantly reduced, balancing the increase from under-consuming populations moving towards healthier diets. The Planetary Health Diet is a sustainable eating plan that emphasizes plant-based foods while reducing the intake of red meat and dairy. This diet not only aims to improve health outcomes, but also to mitigate climate change by lowering dietary emissions. Dr. Yuli Shan from the University of Birmingham notes that animal-based products have a greater potential for reducing emissions compared to plant-based products. By focusing on reducing the overconsumption of emission-intensive foods, particularly in affluent countries, significant health and climate benefits can be achieved. Low-income countries. The study reveals a stark contrast between affluent and low-income countries in terms of dietary emissions and inequality. Affluent countries, such as Australia and the United States, consume high-emission diets, but exhibit relatively lower levels of inequality. In contrast, many poorer countries have diets with lower emissions, but face higher inequality levels. Professor Klaus Hubacek from the University of Groningen highlights that low-income countries face greater challenges in achieving healthier diets, with over 1.5 billion people unable to afford the Planetary Health Diet. This disparity underscores the need for targeted policy interventions. To encourage dietary shifts, researchers suggest implementing incentives like carbon pricing, eco-labeling, and expanding the availability of less emission-intensive products, such as vegetarian foods. A well-designed food environment can reshape dietary patterns, while urban planning and infrastructure development can help reduce barriers to adopting healthier diets. However, in countries like Mongolia, where traditional diets rely heavily on red meat and dairy, shifts may not be feasible. Instead, improving national nutritional education is crucial to promote healthier choices within cultural contexts. Low-income countries face significant obstacles in transitioning to healthier diets. Agricultural efficiency in regions like sub-Saharan Africa and South and Southeast Asia has stagnated, limiting their ability to produce or import the necessary food. Prof. Hubacek emphasizes the need for increased agricultural efficiency through improved crop and soil management techniques, and the introduction of high-yielding crop varieties. Additionally, reducing restrictive trade policies that raise food prices is essential. Policy efforts must focus on making nutritious food more affordable and accessible, especially for lower expenditure groups who often opt for calorie-dense, less nutritious options. Adopting the Planetary Health Diet on a global scale would necessitate substantial changes in food production. The supply of red meat would need to decrease by 81%, sugars by 72%, tubers by 76%, and grains by 50%. Conversely, the supply of legumes and nuts would need to increase by 438%, added fats by 62%, and vegetables and fruits by 28%. These changes could lead to fluctuating prices of agricultural products and land in global markets, potentially causing spillover effects into other sectors, such as biofuel production. Despite these challenges, the potential benefits of diet shifts in reducing emissions and promoting health are significant.